Hi, everybody. Happy St. Patrick's Day. We're just going to check our AV really quick. Just asking the team, can you hear me? Okay, they're saying yes. Welcome to our St. Patrick's Lucky Next Best Neck. Just by way of overview, we're not going to talk about surgical today. There is a facelifting webinar available on YouTube, and you can watch that if you're interested. So today is what I call next best. It's options that you might have, certainly here at Clear Dermatology, when you're not considering surgery. Reminder, I am a surgeon, but one of my favorite things to do is give people options that are non-surgical just in case, because I feel like I can offer the gamut and I have a really good understanding of what's going to help people reach their goals. So let's see. Oh, just a reminder, I always say this. I don't mean to be draconian. I really would prefer it if you don't take pictures of our slides. Our patients have been so wonderful to let us share with you to help give you ideas. But please do not duplicate without permission. There's lots of information at Clear Dermatology at my Instagram. So if you just go there, you can see it. And this is recorded so you could watch it another time. I always remind people this. Can you actually lift your neck or jawline without surgery? That really is the holy grail. And in my opinion, it really doesn't exist. And I think we need to be really mindful of trying, especially to do this with fillers, something I've been thinking a lot about. And I want to comment on some of the negativity surrounding fillers. I love fillers. We all love them here. It's not that fillers are bad, it's really the person who's using them that might give a negative aesthetic outcome. And so, if you're trying to make changes to your lower face by filling and filling and filling your mid face or your upper face, that isn't going to reach your goals. So, just something to keep in mind from a philosophical standpoint. Here's why, and this is very important to me as a surgeon. This is a kind of a complicated slide, but it's very important. You see those white things? I don't know if you can see my arrow, but there's white. Your face is bolted into place at certain areas, and I'm going to point them out on my own face. Right here, and right here. And when we operate, I'll give you, for instance, a brow lift. If we're trying to lift your brow, we actually have to release those ligaments. And it's hard, hard work. We take instruments and go underneath the ligaments and carefully release them so we can reposition them. There really isn't anything else in life that can move your face because you can't release ligaments in that way. So we have to work around the ligaments to reach your goal. And that's a really important basic anatomy that I want you to think about when we're talking about next best options. So, we're going to talk from simplest to more about your options for treating your neck. Medical grade skincare is a basic for everybody. It's just things that we think can work better than almost anything else. And we've curated very specific items. Dr. Letowski works so hard to have skincare that's backed by science. And all of us try to help you find your way. I have patients come in with bags of things that they've bought, and it kind of breaks my heart. And we're here to give you guidance so you don't end up with bags of things that may not work for you. I know it's really tempting, and everybody wants to find, again, a holy grail in skincare, but we're really happy to help you here. Everybody here is happy to help you. And again, there are great things that are specific to your neck that work a little bit better than others. We're going to move on now to neuromodulators. And I talk about this in almost every talk because neuromodulators are, I'm going to use the term Botox like substances. And I often will tell patients, do you know how this works? And just a reminder, Botox like substances, and there are many on the US market that are called neuromodulators, which we have here at Clear Dermatology. They actually aren't meant to treat wrinkles. They were actually discovered to treat lazy eye. So, lazy eye is when your eye muscles are not moving properly. These are muscle treatments. So when you move, you create wrinkles. So these are muscle relaxers. Something that's really important is that you find somebody who understands anatomy because treatment with neuromodulators are based in understanding facial muscles. If you've ever seen me as a patient or attended one of my webinars, you know that I just adore looking at everybody's unique facial anatomy. I've dedicated my whole life to that, and I love to look at how are your muscles working. But this becomes important when we're talking about neck. So just a reminder, these are some of the neuromodulators available on the US market: Botox, Dysport, Xeomin, Daxxify. All of them are available at Clear Dermatology, and we can help you find the one that works best for you. So I have a little fun picture here of a nerve talking to a muscle. What happens with neuromodulators is the nerve stops talking to the muscle. The message doesn't get through. But guess what? Your body is way smarter than that, and it makes new ways for the message to get through, which is why these are not permanent. So here the muscle can't talk to the nerve, but later it does. Again, why it's important to seek a provider that has a really detailed anatomic knowledge. You have to understand what is the muscle that you are treating actually trying to do. So this is a picture of your most important neck muscle, the one that makes the bands that you hate and some of the wrinkles that you hate. Additionally, it pulls down. So that's kind of a bummer because it pulls your jawline down just a few millimeters. So why do we say that these neuromodulators can lift? They don't actually have a true lifting power. What they do is they prevent the muscle from pulling down, so other muscles in your face that pull up above it become more prominent. And so that allows you to have a release and a lift. But it's very important to understand where the power is coming from. And again, why you want to seek providers that have detailed anatomic knowledge, because if you don't really understand what is the basic movement of that muscle, you don't know how to harness the power of relaxing it. So, neuromodulators are wonderful treatments along jawline and neck to create a release and a few millimeters of sharpening and quote unquote lift. Non surgical, next best thing, kind of minimal by way of um, treatment. So, after skincare, a next best option might be neuromodulators. I love Nefertiti. Great picture of Nefertiti. These treatments are called Nefertiti lift. I don't know that I can give everybody a Nefertiti jawline and neck, but that would be the goal. And these are called Nefertiti lifts when we do them with neuromodulator because they're aimed at sharpening jawline and releasing jawline and neck to not be pulled downward. You can also use fillers for your neck, and they smooth out fine lines and wrinkles. So let's look at some options for that. Again, this should be done with somebody with a detailed anatomic knowledge because you want to have them more superficially. You don't want to risk lumps and bumps. And there are certain very special ways that we like to do them. So this is a picture by the great Dr. Latowski of Radiesse and Bellatero mixed in the neck. I think she calls it magic solution. So this is also what we call biostimulatory, which I'll get to, where the wrinkles are actually being effaced not by just the influence of volume, but also by making their own new collagen, which is the holy grail. So this is one option for neck that we like very much to make the lines on the neck softer. And the reason why I used a diamond necklace before is because we refer to these as necklace lines. So here we are. I want to talk a little bit about that collagen holy grail I was just talking about. Here I am with the most amazing team, Bree and Regan, showing you slinkies. So I don't know how many people played with slinkies growing up, but I did, and most people have a really fond feeling about slinkies. So what I want you to imagine is between all those bolts on the neck that I showed you, are some slinkies. And if you treat the slinkies in specific ways, the slinkies shrink. That's what collagen looks like when it shrinks. So, this is the way that we take advantage of next best neck. We work between the ligaments, all these tiny, tiny slinkies lined up, and get the slinkies to shrink. That doesn't move the face, it doesn't reposition the face, but it can certainly address laxity and also tightness. It smooths. So, again, no repositioning. We're not actually moving anything. We're just getting those slinkies to move in a line in between the ligaments. And that's how we get next best neck. That is a little bit what we just talked about with fillers. This, you get more of those slinkies when you put biostimulatory in. But let's talk a little bit about how to get these slinkies to shrink. We're going to talk about that now, but I just want to tell you quickly, buried in here are some specials for each of the slinky shrinkers that we're going to talk about. And they're available through 4 p.m. tomorrow. And you'll see each one of them after I explain it to you. Soft wave. I want to pause here and talk about something that I chose for myself for my 50th birthday, which was 3 years ago. Before I worked here, I did not have access to a soft wave in my office, and I wanted to treat myself to something. And I had to look for it and I had to pay for it myself. And I researched really, really hard, soft wave and a competitor, which I'm not going to say doesn't work, but if you want to talk to me about it, I can talk to you more about the competitor. We have a soft wave, and even before I worked here, I chose a soft wave and I paid for it myself out of my own pocket. So, with all my knowledge, this is what I chose to help with my slinky shrinking for neck. I did full face, but you can choose different areas. This has no downtime. It's actually ultrasound that pushes energy toward your slinkies and causes them to tighten. It takes some time. It's not as quick as our video. You do see changes over about 3 to 4 months, and it's gradual. I did another one recently to follow it up. This can be an every year, every 6 months treatment, and it does also make new slinkies and shrinks the slinkies. This is a wonderful treatment. So this is a picture of a before and after of our soft wave. There's a few of them, so you can see again tightening along the jawline but not repositioning. So we didn't move or change any of the ligaments, just we smoothed the skin along the jawline and decreased laxity. Here's another picture of a before and after along jawline and neck. I'll just pause there for a second. I should have put mine own in, but I don't think I have any from several years ago. And another one that you can see improvement in skin laxity, skin tone, and smoothing. So if this particular treatment interests you, we are including a medical grade skincare and discount on this. So the regular value, again, no downtime, is only if the regular value is $21.50, it's only $1,500. That's a great deal. That's actually less than I paid for my own, and only 10 are available again through tomorrow afternoon. And that's a great savings with some medical grade skincare to maintain your treatment. Fraxel is another treatment. Our Fraxel goes all day, every day. This is a great laser. So, ultrasound and laser are not quite the same thing, it's different types of energy. Fraxel is also another way that we get new collagen, and it also is wonderful for pigment. So, some of those those crepey fine lines that you have in your neck, pigment in your neck from sun exposure, which is hard to treat. Fraxel is a wonderful treatment. You can treat almost all areas of your body, and it's also minimally invasive. Very little downtime, although you can expect some peeling at days 2 to 3. So, yet another next best option based on your goal. If your goal is pigment and fine changes to your neck, I think Fraxel is a great option. Here's some pictures of Fraxel neck showing smoothing of the lines. improvement in pigment. Our latest and technology, and one of the best and new special technologies on the market, is our Ultra Clear. There have been other webinars on this if you want to learn more about our Ultra Clear. It uses what's called erbium YAG technology. I've had about 10 years of experience using erbium YAG, but this is a very new laser, upgraded technology, and it uses what's called cold laser energy. What you need to know about that is it decreases downtime. So people are maybe familiar with traditional CO2. Ultra clear is a cousin of CO2, meaning it does impact the first layer of skin and make targeted microscopic little indentations in the skin so you grow new skin, tighten your collagen. It is actually great for deeper lines and deeper wrinkles. One other thing that I want to mention about Ultra Clear, even though we're talking about necks, this is the first laser that I've used in my whole career, and I've been lucky enough to have access to lots of lasers in my career where there are established safety guidelines for upper and lower lid that I feel confident in. So it's also a great treatment for eyes as well as neck. It does have less downtime than, again, its cousin. However, there is kind of an impressive and dramatic days 1 through 3. So I would say it has the same downtime as Fraxel in the end, but a little more dramatic days 1 through 3, whereas Fraxel is a little more dramatic by way of peeling days 3 through 5. We have a great way of keeping track of you. We watch your photos every day on our electronic medical record. Your provider looks at your photos every single day to keep track of you to reduce risk of infection or any other problem you may encounter. We take our care for you so seriously, and we individualize everything that we do. This is not a discount practice, although we are going to offer a discount on Ultra Clear just because we're so excited about it. But our care for you is really, really targeted, and we make sure that we do everything we can to reduce risk. So this is a picture of a treatment I did. I want to be very clear here that this is a combination treatment. So remember we talked about the biostimulator. This is kind of a buzzword. That means it tells your body to make more collagen. So biostimulators are multitude on the US market. One was the beautiful picture that you saw of Bellatero and Radiesse that Dr. Letowski did. That can stimulate your own collagen. In this particular case, this is a combination treatment, not all same day, where both that was used and then Sculptra. Sculptra is a biostimulatory treatment, but not a filler. So there's no true volume. So this was a combination of biostimulators and Ultra Clear. So that's what we decided to offer in our package for you today. Is you can have the Ultra Clear and Sculptra. This is a great price. The normal value for this is $25.50, but it's only $1,900, and they get treated together. So the Sculptra goes in first, and then the lasers on the outside. I have always referred to this as collagen inside out, biostimulatory, in this case, Sculptra, and collagen outside in. So the laser is creating outside in tightening of our slinkies and new slinkies. And then inside out, it's being told to make new slinkies. So this is a combination treatment like you saw in the picture, also a package that we're offering today. Agnes is yet another treatment that's radio frequency. There's lots of radio frequency treatments out there. This is good for most skin types, multiple areas of the body. One thing that I'd like to point out about Agnes is that it can also be used to treat unwanted fat, for instance, in the jowls or under your chin, called the submentum. So that can be in combination with tightening and with smoothing. So if that is an issue for you, this may be a great option for you. We'll look at some photos of Agnes. Here's a treatment I did with Agnes where you can see the submentum, again under here, and the neck was treated. Improvement in line and a little improvement in sharpness under the neck. So if this is a treatment that appeals to you, this is also something that we're offering. Agnes, a medical grade skincare. Regular value is $26.50, savings of $6.50. So webinar exclusive, only 10 are available through tomorrow afternoon. So that sort of concludes all the different things that I wanted to talk to you about today. But as always, I'm open to your comments. I just need the team to come and get my chat up. So, excuse me, I'm not as adept at making sure I can see. So, I want to make sure that if there are questions, we definitely have time to answer those today. So, let's see. So, is it in Q&A or is it in chat? So if you do have questions, go ahead and put them into Q&A and then we can answer them. We can also try to see if we see chat. Let's see. Nope, we just have Q&A. So if you have any, should we reshare? Yeah, usually it's just. So if you have any other questions, we would love to see them. But if there aren't any other questions, we would love to see you actually in the office and help you find the best possible treatment for you. There's chat, but I don't see any pictures. How many treatments are needed for the ultra clear and the biostimulator? Okay, thank you so much for that question. Ultra clear is usually one time, but it can be repeated. The biostimulators, we usually say 3 to 5 treatments for Sculptra. And with the other biostimulatories, those last a little longer because of volume short term. So let's say you inject Sculptra. You want to repeat that every 3 to 5 times monthly, but it has longevity up to 5 years proven. The filler biostimulatory, which would be Bellatero and Radiesse, are actually last about 6 months, but need to be repeated. So it depends on your goals and we can help you find that. I hope that answered the questions about treatments. I also saw a question about I am not a laser candidate. Would I be a candidate for soft wave? Most likely. Again, soft wave has very few contraindications, but we would like you to come in and talk to us about it. And most people are soft wave candidates, even if they are not quote unquote true laser candidates. Does anybody else have any questions? We're just going to go back to chat. I don't see any other questions. So again, if you have more questions, we always want to see you in the office. Oh, what are the pain levels of the Agnes and the soft wave? Oh, I can speak to the soft wave from experience. The soft wave does have some discomfort, but we try to use distraction technique. It is hard um, to give topical or deep anesthetic to the areas because it is a deeper treatment, but we do everything in our power to use distraction to help you feel more confident, and you can use some over-the-counter meds to make it more comfortable for you. For Agnes, we have an easier time because it's a little bit more superficial, and we can treat you more easily with a topical anesthetic and an injectable anesthetic. So most people with Agnes report little to seriously zero pain. So what else can I answer for you on that? So I'm going to take another look at let's see, do these need to be redone over and over, or are they longer lasting? It really depends. I would say in general with any laser, or let's call it energy, which would include soft wave and Agnes, if you had a twin, this is what I always say. If you have a twin and you get treated and your twin does not, you will always be more improved than your twin. So if you have a twin, you can make it a competition. However, I can't stop aging, even though I wish I could. So people will continue to age over time. Many of these are yearly for upkeep, but they don't have to be repeated over and over. I hope that answers the question about redone and long lasting. Anybody else have any other questions? We're just keeping track of the chat right now. Okay, so thank you so much for joining us for our webinar today. Again, happy St. Patrick's today. I hope you have luck today, and we look forward to seeing you in the office. Thank you so much. Bye.